Hi, today I thought I'd show you some stretches for your outer hip. So often people complain when they're pregnant about pain in their pelvis, and sometimes that pain can occur when they're asleep and there's a lot of pressure on their hips because they're having to lie on their sides. So this is just 3 stretches that you could do to release your hips, maybe before bed and then in the morning as well, or maybe if it's waking you up at night, you might, even if you're so awake, you might decide that you just do a few of these just to try and relieve the pain. So first of all, starting with your feet hip distance apart and about a 90-degree angle in your knees, and placing your hands behind you. It's not too important where they are. You just need enough space so that you can link your ankle over your knee. So depending on the size of your bump, you may need to sort of slightly lower the knee that's supporting it, or come a little bit further back. So just finding whatever's comfortable for you to get that stretch. And then you're just aiming to gently push that knee away from your body. So you don't want to put too much stress on the knee because of all the relaxing that's in your body. Our knees are quite vulnerable when we're pregnant and also when we're breastfeeding because the relaxin stays. So you don't want to really be pressing with your hand, but just gently pressing into your other knee and moving that knee away from your body. So you should be able to feel a bit of a stretch down the outside of that hip. And then we can switch sides. So do the other side. So you're even. And try not to collapse into your back too much. Trying to open your chest and grow tall at the top of your head. And then the next one is child's pose. So this time bringing your knees as wide apart as you need to accommodate bump, and then lowering your hips towards your ankles so that your bum comes as close to them as possible, and then you're reaching out, and if possible you're resting your head on your mat. If you can't get your head down to your mat, some people find it uncomfortable whether they're pregnant or not, but maybe your bump is now too big that you can't reach that. You might use a block or a couple of cushions or a bigger block under your forehead, and then reaching out with your hands, extending out. And again, this is opening up the hips, stretching down the sides and releasing the pelvis. It's great for the lower back as well. So it's serving a multitude of jobs, problems. So, and then finally, it's kind of a modified pigeon. So because we don't want to put too much pressure through the knees, a full pigeon might be too much for you in pregnancy, it might not, depends how much you've practiced yoga before. But this time we're bringing our knee, doesn't matter which one because we're going to do both sides, but bringing the knee towards the same hand. So I've got right knee to right hand, and then just bringing your toes in a little way towards the other hand. So if I come to face away from you, you can see that I've brought the knee in and then the foot over a little towards the other side. And then we're going to come up onto our toes on our left foot, and we're going to just gently move backwards and forwards. So coming as low as you feel comfortable in your knee. So not putting too much pressure through that knee, but you're getting that stretch down your outer hip. And depending on how comfortable you feel, you can bring your foot further up towards your left hand but I say I wouldn't go too deeply into that position unless you are confident and have done plenty of pigeon poses before. So then just coming onto your knees and bringing the other knee in towards your hand, extending that other foot out, bring that foot across, and then coming onto those back toes and just gently moving backwards and forwards. So once you've done a couple of backwards and forwards movements, you can release that back toe down and just rest in this position. If it's uncomfortable for you, you can bring your foot closer to underneath that same thigh. So rather than having it out towards the opposite hand, it can be tucked further in. So then you're not putting as much pressure on the knee. Okay, so that's three releases for your hips. Hope they help.